can you comment on the place that the United States stands in terms of quality of health care among all developed nations in the world?
Sure. I heard someone in the back say we have the best health care in the world. And you know, if you're lucky,
you're a millionaire.
If you're lucky enough to have good insurance and you're lucky enough to get to go to Cincinnati Children's, you probably do have the best health care in the world. But you heard others talking that have fallen through the cracks or have seen others fall through the cracks whom they were once responsible for. We spend twice as much as any other country in the world on health care per person. We have some 40 million people that are uninsured, another 30 million or so with less than adequate insurance. Yet we have, of the wealthiest countries in the world, we have some of the highest infant mortality, some of the highest maternal mortality, some of the lowest rates of inoculation, some of the lowest, I see Francie here, some of the lowest taking care of our youngest and sickest people. When we have the technology, we know how to do it, but our system just doesn't work as well as it should, and that's really why we're here today. Next question.
Hi, Senator. Thank you for taking my question. My name is Jennifer Chavinsky. I'm the Director of Health Data Improvement at the Health Foundation of Greater Cincinnati. And we just ran our annual Ohio Health Issues Poll in collaboration with some researchers here at the University of Cincinnati. And one of the findings that was very interesting is that over 30% of Ohio adults are going without or delaying needed medical care, dental care, or prescriptions. And these numbers are very concerning on their own, but when you separate that out by insurance status, you see that the uninsured, over 50% of the uninsured are going without needed medical care, dental care, and prescriptions. And this probably isn't surprising to anyone in the room, but the statistic that was most surprising to me is the fact that 25% of insured Ohio adults are going without needed care. So my question for you is, what is healthcare reform going to do for the insured who can't afford to get the care that they need?
Thank you for that question. The legislation, first of all, as I mentioned, the legislation will build in consumer protections for those who already have insurance and are satisfied with their insurance so that they can't be denied care for pre-existing condition. It means they will get with no copay or no payment out of their pocket. It means they will get preventive care. They'll be able to get the mammogram that Sandra talked about. They'll be able to get other kinds of preventive care without having to pay out of pocket, so that will cut their costs. And it means if people think their own insurance is not good enough, and many people in this country have insurance that they think is less than adequate, it means they can go and get a choice. They can go into this what we're going to write in this legislation, what's called the exchange. And the exchange simply is a menu of choices. And this bill is all about choices. It's not a government takeover. It's all about choices. This bill is about choices. So you'll be able to choose. If you think your insurance isn't good enough, you'll be able to choose. Do I want Aetna? Do I want Cigna? Do I want Blue Cross? Do I want Medical Mutual? Or do I want the public option? What Medicare look like? You will get those choices, and that's what this legislation is all about. The last thing it does is if you have insurance with a small business person like Gary. Gary clearly is an employer, as most employers are, small and large alike, that wants to take care of his employees. He wants to take care of them because he cares about them. He wants to take care of them because it's good business. He wants to take care of them because he's an upstanding member of the Cincinnati community. So, but he needs some help in his plan because of what's happened. So we're going to do the insurance reforms. We're also going to give incentives, tax credits to small business so they can stay in business and be the part of the community they want. He wants to insure his people. He wouldn't have come today if he didn't want to insure his people. He wants to find a way to do it that's not going to drive his company out of business. And that's in the interest of all of us. mind, and this is not required certainly, but if you'd state your name and anything about yourself, if you'd like, it's not required, there's no requirement of any kind, but if you'd give us your name, if you'd like, as you go forward.
I'm Mrs. John Coles. You were just speaking about my freedom to choose from Aetna or Blue Cross, whatever. I have a health savings account, and I like it. I save money by having low premiums with a very high deductible. I pay for my doctor's visits, I pay for my tests, I pay for my prescriptions, and that way I save money in the long run. Now, future plans, I will have to choose a plan that covers all those things. I do not want that kind of plan. I like my health savings account. I like to pay for my doctor's visits. I like to have that freedom to choose where I go and what tests I get. I do not want the government interfering with that. I think there's a little misinformation there on the website that I have the freedom to choose. Now, Mr. Anderson brought up a point that the government already pays for, over half of our medical costs, which makes me think